Welcome to the June 22nd Sutton Board of Health meeting pursuant to GL Chapter 30A, 1825. You're notified of this meeting and agenda that we're on live and it's being recorded. The first order of business is reorganization. Anybody want to reorganize? So I don't think we really had any plans to do that.
Not right away, no.
Does anybody have any desire to get into that conversation, or? Okay, can we wear funny hats maybe, and,
You can hear it?
yeah,
Okay.
all right.
Good luck.
Local upgrades variances, none. Local upgrades review only. Steve, you're on
Okay,
camera.
we have 4 of them. First one's 194 West Sutton Road. Approved the plan. What they were asking for a local upgrade is a 2-foot separation. It's a Presby system. That's approved for a 2-foot separation for remedial use through Title V. So they designed this Presby system, and it actually was able to lower the ground around that way. Won't be so much a mound, and right behind this system is a big drop-off. So it blends in there, and they can make the grade on the back side. So that worked well for that site, that system, and that asking for that local upgrade.
Okay.
Second one we have is for 11 Westview Drive. Let's see, the local upgrade was a separation distance of 57 feet from 100 to their own well. Their well is pretty much right behind the house, pretty much right in the middle of the lot. So they've maximized the distance they can get the septic system.
Where's the septic going in on that?
Going in the front, on the
Is that where the
street.
perk test was done?
Yes,
Okay.
yes, right up in the left front corner of the property.
And the well's in the back?
Directly, right behind the house, only a few
Right
feet
behind
behind
the
the house itself.
Okay,
It's, I would say it looks like 5 feet behind the house.
okay.
So it's, the well itself is not in the best location, but they were able to get over 50 feet with that leak system. So that's about the best they can do on that property with it. All right, the next one we have is 54 Putnam Hill Road. We're asking, the design, they were asking for 2 local upgrades. That's a 4-foot separation to 3 foot for the groundwater separation. And they also asked for a sieve analysis to be done because it was too wet to perk at the time of the testing. Groundwater was too high. So those are 2 local upgrades that were asked for. And as far as the groundwater separation on that lot, that again, this is a very wet area and it doesn't have much grade. Lowering the system here is going to help them a lot right behind the house in grading and shedding the water away from the house. Right now there is a slope from the tanks and the leak system toward the house. This will reduce that and give them a little more area to shed the water left and right away from the house.
So septic's going in the back of this house?
Yes, it's behind the house.
And where's the well?
The well is up right near the street, in the middle of the lot.
Behind the pine trees or
It's behind the,
to the right of the house?
it's pretty much in the center of the house. Just off, it's probably about 20 feet off the pavement of the street. It's right near the street.
Is it above ground, the cap on the well?
I don't know,
Or is it buried?
Diane, I'm not sure what they have. I don't believe I ever saw the well out there.
Yeah, because it doesn't look like it's above the ground.
Yeah.
That's where it is?
Andrew's survey did the plan, so they located it. That's what they're showing on the plan. When I was out there with the soil testing, that was before they did the topographical survey and found all the information there. So that's where the well ended up, and I never saw it at the time of the testing.
So we know the well's there, or we're just assuming?
They're stating that it is there.
It is there?
Andrew is stating that's where the well is. It's an
And
existing
the
well.
septic's going in the back?
Yes,
Okay,
behind the house.
okay.
All right, and the fourth local upgrade is for 10 West Sutton Road. And the local upgrade that's being requested for that is a 3-foot separation to groundwater also. Is that?
Still have those plans.
Oh, yeah, correct. Yeah, that one, that was another situation. It's a mounted system. They reduced it. There's a grading issues out there, and this all helps them blend in the system into the existing topography and the landscape that's there.
Is that a duplex, or is that a single-family house?
10 West Sutton is a single family.
Single family.
Single-family with 2 mailboxes? Single-family?
I was single family. I was out there. I saw the house was a single family house. I don't remember looking at mailboxes and.
What does the card say in that? Do you know what the card says for the bedrooms?
No, I don't have the card.
I don't know, it's
How many bedrooms are they doing in that one?
just 3 bedrooms.
I'm just questioning whether it's there's an apartment in
It's a
there.
duplex.
Because it looks like there's 2 mailboxes.
For that same address?
Yeah. Because it's right aside of number 8, which is that house that has the tight tank. It was a little house and they built it up 3 stories. That's right next door to it. Looks like there's 2 mailboxes.
That one.
I just think you should just take just another look at that and make sure that there's not 2 mailboxes that say 10, that say,
10 and 10A or something like that.
yeah,
Okay,
that's all,
I'll do that.
yeah.
All right. And yeah, those are all the local upgrade requests for review.
Thanks, Steve.
Thank you.
Department update.
Sure. Did you want to finish Steve up before, or do you want
I thought-
that people see you? Do you have any other things you want to talk about,
Stick
Steve?
around.
What's that?
I can stay.
Okay, I just didn't know.
Fine.
Oh, okay.
Thank you, Cheryl.
Okay. Department House.
The hell?
What was that?
You may want to go.
You got our attention.
Jeez, I
that
thought it was
me?
a foghorn.
I know, I thought it was a fire.
And then all of a sudden,
Was that in the house, in here?
Dang,
If you want me to
that's
go.
loud.
You know what? We all
I thought it
reacted
was a
pretty
fire
good.
horn or something
I did
like for the
too.
fire
All
department.
jumped.
sorry about that.
It's all right. That was great.
Now it works though.
Oh, no. it
Excellent.
works.
Well, whatever it takes.
Okay, department update. We're at the end of the fiscal year, and it's been quite the year. COVID is all over, and I will update COVID after I finish my department update. It's been a very busy year. It's very busy now where Judy is doing a lot of renewals for permits for the end of for the beginning of the next fiscal year. A lot of septic, a lot of food, camps, things like that. I'm doing a camp inspection tomorrow at Camp Blanchard.
They opened, right?
Oh, they're not open yet. I have to do my inspection first. But they gave me a binder about 6 inches thick. I don't know if you happen to see it on the table out there. But it's in very good shape, so that I'm very pleased with that. Long time coming, but they actually went to, they heeded my advice and went to Clara Barton Camp to see what they needed for specifics as far as policies and procedures and things like that, so very nice job. I'm having 2 Serve Safe classes, and Judy was kind enough to put it out to all the food establishments in the area. So I'm doing one this coming Saturday. Both of them are going to be at the Senior Center. On the 26th from 10 to 12, and Tuesday, July 13th from 4 to 6. So we've got a half a dozen people going, already signed up for the Saturday class. And I think the following class in July is going to be a lot bigger. I've already got commitments from 12 people. So I may split it up or have an additional class in September or something. So that's that.
Is that for like local businesses?
Yeah,
Well,
yeah.
is it because that they were delayed and couldn't get into them for the past year, or?
No, I think that they were probably just all expiring,
Okay.
things like that. I had attended there was a virtual meeting from MIHA, which is the Massachusetts Environmental Health Association. They had a presentation on the new bylaw that was passed, or the new law that was passed in January regarding health regulations in agricultural activities. And that basically it says that the Board of Health cannot pass any laws that impact agriculture. It has to bypass the Agricultural Commission in the community if it has one first, before the Board of Health can make any laws. And they talked about what constitutes and doesn't constitute a nuisance, things like that. So it's rather interesting.
Would that have something, would that situation we had down on Wheelock, would that have fallen into that
I
category?
don't think so, because we don't have an Agricultural Commission.
Okay.
So it only pertains to a community that has an agricultural commission.
Oh, I see, okay.
You have to pass it by the Agricultural Commission first before the Health Department adopts anything. Basically, a lot of zoonotic, which is insect-borne diseases, are starting to peak now. Tick-borne is really, really up there. In the past week, I got like 20 tick-borne cases. And they're out, they're very active, and it's also mosquito season, triple E. So basically, it's the season and the 5 Ds, to, drain your areas, dress accordingly, use DEET, and be aware of dawn to dusk timeframes, things like that. That's when they're most active. So other than that, that's basically about it. Does anybody have any questions about departmental update before I go into COVID? No? Okay. So COVID is now over, so they say. I just want to give you some figures because I presented them to the selectmen. I put them all together for the selectmen, and Judy and Grace also helped me with that. So the number of cases that we've had, confirmed cases, were 825, probably 830 now, that's since last week. But that's just the confirmed cases of COVID, but there were also cases that considered suspect, probable, or they didn't classify them, but they were still cases we had to investigate anyway and follow up on. Came to over 1,250. We had 16 COVID-related deaths, and that's deaths that were listed as COVID as the primary cause, not if you had pneumonia, and they listed COVID down the road, so that was not considered a COVID death. So we've had almost 20,000 people tested in this town for COVID since the beginning of tracking. A lot of people were tested twice. Some people were tested monthly, whatever, so that's a lot of testing. And that was done, and that's an old number, so it's gone up before that. We've had quite a few people immunized. The clinics that we participated in on a regional basis at the Uxbridge Clinic, worked on those Tuesdays and Saturdays, got a lot of people through the community immunized. And we did 20 homebound seniors, So they were all taken care of. And just a week ago today, we had our second school-based clinic at the high school. And we did 90 kids on that day. The first clinic we had 3 weeks prior, there were 82. And over 50% of the high school students that could be immunized in that age group have been immunized. As far as the town goes, we have one of the highest rates of immunizations in Blackstone Valley, if not the highest. And there's quite a bit of percentage of people 50 and over that have been immunized fully. And the chart that I have is only residents that have been immunized in the state of Massachusetts, not a lot of the people that go down to the south, to Winthrop down in Florida, and get immunized down there, so they are not included in our statistics, but so it's much higher than that. So that's basically about it. It's been a long time. Long time.
That's a lot.
So that's about it. I don't know if anybody has any questions or any comments about anything.
Now everybody can go to Walmart and the pharmacies and get vaccinated.
So that's what it is now, because all the sites are closing down. So the
Yeah.
big mass sites are closing down. I think the last one closed today. But our regional site officially closed, but we're doing little bits here and there. But a lot of the pharmacies have increased their hours, and a lot of them have walk-in hours now, and they have all 3 drugs that are available.
Yeah.
So you can get them. So that's that. And so the state of emergency has been lifted. So that's done and over with. Masks are optional. I know some places, businesses, if they want you to have masks, they will have the sign on the door, and they can still write their own ticket as far as what they want for masking, things like that. But that's about it.
Great job to both of you.
Yeah.
Yes.
this is
You were locked
crazy
in
time.
that little room for
Fastest year of your life.
Crazy
a
times.
long time.
Judy and I, we bonded quite well.
Yeah.
Crazy.
It was a long haul. It really, really was. And it was a team effort by a lot of people, but it was Judy and I for the most part. Nights, weekends, holidays.
They did a nice job down at Uxbridge, the vaccination center.
Yep,
It was just so easy.
yeah,
Very well done, very well organized.
yep. So I worked on that one, but my main one is I was usually the night and the weekend in Upton. And we put through, and that small site, which they considered a small regional site, about, I think it was 25 or 26,000 people. We went through that site.
Wow.
So, yeah,
A lot of people.
yeah, a lot of people.
Good job. Minutes, do we, what's this, I know, what's the
on
plan?
my list.
Huh,
What's the what?
What's the plan like this, get a couple here and there, or,
I guess, yeah.
yeah. How far behind are we?
A year and a half.
Who knows?
No, 1 year.
1 year.
1 year.
It was COVID. Everything
COVID
stopped with
year.
COVID.
Yeah, I was just wondering at some point, when they're gonna forget that COVID ever happened and start putting the pressure on to,
Yeah.
Well, it would be nice to have at least a couple of months before the next meeting, if possible.
When's the next meeting, September?
I have, Diane,
You're
you know
right,
what?
Diane, I'm
We-
gonna have the
yeah.
accountant on me
Yeah,
soon.
we can't even keep up with anything, to be honest with you. We're just so far behind with everything. She knows that they
These
need
were-
to be done.
these-
I know
these
they
are
need
ones
to
you
be
signed
done.
off on.
Jim Smith
Yeah.
knows they need to be done.
we already did that last
Well,
time.
we're not the only board that's behind anyways, I mean, this
Well,
is-
yeah. We're the only board that worked with the pandemic 24/7.
there's a lot of boards that are behind on their minutes,
Well,
yeah, so it's,
but
In other towns, yeah.
yeah, other towns,
Yeah.
yeah.
Okay, old business, new business?
how did the inspections on the food establishments and the markets go? Have we had any problems with those?
Ray has been doing them. He
I
sent,
don't have his reports yet.
did he send an invoice?
He did send an
Oh, 'cause I
invoice.
just saw the email, but I didn't.
I didn't even open the
I didn't
email.
even either. Ray has been coming in. As, I don't think all you know that Ray works for the town of Westboro in the Board of Health, so he's been heavily involved with COVID also, because he's been doing COVID cases also. But he has been coming in and doing inspections, and he will have all the inspections done before the end of the fiscal year. He did not mention many, if anything, about any problems that he thought with any areas, so.
Okay, have we had any new businesses come into town?
Speaking of which, we do have one that's coming in. I think it's going into Galaxy Paths. That's all we know. It's a duo Italian and sushi restaurant. That's all I know.
Oh, fun,
Unique.
What's that?
fun.
So they actually came in, well, evidently, they've been working with John, and John's been telling Kucha from the building, been telling him to please get over to the Board of Health, get your plans over, whatever, and so we came in today.
When did the hairdresser go down at the plaza down on corner of Boston and 122A? There's a hairdresser in there. Do you know when that business went in?
We don't do hairdressers, so we don't inspect them.
I don't-
There's a,
St. Laurent?
what's the flower shop down there and the dog grooming place? in
Oh, yeah,
Jen's
yeah,
Street?
yeah. She's been there forever, that
Okay.
hairdresser. I mean, forever. 20, 30 years, 20 years. Since
Not aside of KP's, right in the
no, in
plaza.
the plaza, yeah.
Yeah, there's been one there,
Yeah.
I thought.
Okay,
Been there for a long, long time.
okay.
I have no experience with anything related to hair, so.
Yeah, I was
We
gonna
can
ask
move
you where you
on.
get your hair done, Bill. Yep. Judy?
All right.
I know, the COVID's brain dead, so what can I say? Bill, I sent you comments from somebody that had a conversation with me. I just forwarded on to you.
And what?
In regards to immunizations and vaccines from a couple of individuals.
I don't remember that.
Yeah, you do, because you gave it off to Jeff to call me about it, and then you realized what it
Oh,
was.
that. Do you want to talk about that?
No, we just had people expressing their views.
Yeah, but they didn't do it professionally or even in a decent way.
No.
But I'm sure you got a lot of that. What was the fallout from that? I mean, did it,
No, I didn't, because Jim and I had been dealing with it for a while.
okay.
We had people that just didn't, that had different views and expressed them.
About the vaccines and stuff?
Yeah.
Well, they're entitled to do that, but they're, yeah,
Absolutely.
right, yeah.
Yeah.
That was out of line.
Yeah,
Oh, what's,
yeah.
yeah,
And, from people who should know better.
right, okay.
It's all
Anyway,
over, COVID's
that'll
over,
flush out.
till the fall.
So, Steve, if you want, you got fee well, Title V?
Yes. So the fees, I have a sheet I handed out, just kind of listing the fees in yellow, are the ones that John, we kind of think that is probably the best proposed fees we should implement. There are columns here from other area towns also, and what they charge for those same actions. Yeah, Bill and I kind of came up
What,
with
do,
these.
do we have a list of what they did they, I assume they went up some overall?
Yeah.
Yeah. Oh, there they are, oh, on the left side, okay, oh, okay, I didn't see that column, all right, thank you, all right, great, thanks, yeah.
15, yeah.
That was a long time ago, 2015.
Yeah, that was what you suggested, Steve, that we didn't go up on that because we were adding somewhere else. Is that the one where we went down in the fee? So it wasn't just a matter of blanket
Yes.
adding adding numbers to everything.
Right.
We looked at stuff that we never charge for.
Right, right,
That we will be now.
right, yeah, right, right.
And it's sort of like, when we did it, it was just a compilation of looking at the other towns and, taking from them, some from them and some, just improving on our own.
Right, right.
We're gonna charge for Title V inspection reports now,
Which one, what are you looking at?
Down at the very last highlighted one.
125, for them, for the Title V to be reviewed. That's new?
That
it's
is
reviewed.
new.
Title V inspection report file.
Are you gonna review them, or is that just filing fee, Steve?
The review
Well,
is up
Well,
here
somebody has to review them to see what they come out,
Yes,
and if there's
And-
any,
Will that be you, Steve?
it would be. I mean, anytime there's a Title V that, especially it needs further evaluation, we
yeah,
definitely have to look at those.
yeah.
There are other towns, I don't, these are suggestions, but there are other towns that charge substantial fee for that
And you would
criteria.
pick up on a Title V that wasn't done, and then 6 months later, it came in and it failed, then 6 months later, it came in and it passed. So you would pick up on the
Yes.
location and the,
Yes,
okay.
keep files on that and
Do the
follow
towns
that.
that charge a substantial amount, do they also witness the Title V?
Some towns do.
Yeah, because like.
There are
in
some towns that
Hopkinton,
send some,
Alston, I
every
think.
Title V has to have somebody from the Board of Health there to witness
So are you,
inspection.
is that what you're proposing to do?
No, no, not that.
No, that's
I mean,
just
substantial. I mean, there are some towns that are, I don't know if you're on our list. I don't think it's anybody on our list, but I think there's somebody that charges,
There's not too many that
$500.
show up for it. There's only a handful.
actually show up for the,
Yeah.
somebody from the town.
A lot of them are getting review fees though. And they're doing a nice job on them. I mean, some get more money, some get more involved. They actually mail a thing saying groundwater's been checked. Da, 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 da.
Oh, like
They
a
send it
checklist?
to you and the customer, you know. And they have a good filing system. But I mean, it's definitely, if it's something that he can take on and you're gonna get money for it,
Sure.
you pay him to do it. It's definitely a
I mean, it's a
plus.
service he's providing, and,
Right.
And, I mean, Judy's been doing the filing, and
yeah.
so there's work to be done with those. I mean, they come in, quite a few of them, you have to
Yeah, right now we
make
just
sure
throw them in the
they're
drawer,
complete and
you know.
make sure they're complete Title Vs and
Right. Yep.
you're the ones that pass.
So your fee, like a review of a septic plan, where is your fee on, which
Yeah.
column does that fall under?
What I charge
Yeah.
isn't
Well, what-
here.
No, that's what you charge, what we charge the customer.
Plan review.
That's,
That's plan review?
Yeah.
Okay, I wasn't sure if that was restaurant plan review. Okay, that's plan review. Okay,
No, this is all septic.
this
You
is
got
all-
plan
all
review,
Title V.
Oh, it's all
Everything
I'm
here is
sorry,
Title V.
I'm an idiot, never mind.
And then you got septic inspections.
Right. And that's what, there's total what, 4 inspections for a typical septic?
they vary, but yes, typically, pump systems, might be more,
Right, okay,
depending on more
Right,
complex
okay,
systems,
alright,
require
okay,
more
yep.
inspections.
okay,
And the contractor also,
right, yeah.
have to go out there to.
Right. I hear you. Right, okay. All good.
Is there a way we can put the septic disposal works application fee, incorporate it with the plan review as one fee?
So the plan review is
Disposal works construction permit fee.
$250.
The septic
and the
disposal works
septic
application fee.
application fee.
It's due at the time that
So
they.
put those two together?
And just
due
make
at
it
the time
one.
of the plan review.
So it'll be a total of
They
three.
forget it a lot of times.
It'll be a total of 300
Have to
instead
call
of
them.
250 and 50.
Yeah, you can just add it together and tell
Yeah,
them
just
they're
make it
paying
one
for
fee.
both.
That would be
Yeah,
easier.
that's what I mean,
Yeah,
just,
that's what
Plan
she's trying to
review
put it
and
together.
septic works,
Yeah,
septic
that would
disposal
be
work
easier.
application.
And then it'll
Yeah.
be one check, and they
Yeah.
won't
Would make
forget
that
it,
very-
Whatever-
300?
Whatever's easier for you, I would say.
Yeah.
you know?
You're the ones
Yeah.
gotta deal
Yeah,
with
no,
these.
that would be easier.
As long as you're
So
adding the money
this-
Because
together.
like Judy says, a lot of them, they just pay for the review and not the,
Right.
So it's
That
a septic
piece.
disposal works application fee included with a plan review.
Correct.
And you do the first revision for free,
Yes,
second revision 150.
any additional revisions after that.
You don't wanna charge for a decommission?
Decommissioning well?
Septic.
No,
Septic?
Septic.
They usually don't. I mean, they usually have to take care of that.
Usually it's at the same time.
Right, they put the new system in,
I check that when I go out there and they're
Yeah.
installing, if they have a cesspool or whatever it is,
Right.
tanks. I check that as I'm out there doing the other inspection, so, I mean, it's not that
That could
we
fall
can't,
under.
but there's only
that
one
could
other,
fall
one
under
other
small
town that
component.
does charge a fee,
Shrewsbury.
There's actually a lot of
We had-
there's a lot of towns that do.
do they?
So
The ones that we had checked out.
we
so, yeah.
do only, and we only run into it when we go back when somebody finds something. You know what I mean? There's not too many towns that we call up and say, this lady called and found in cesspool, she wants us to decommission it. They're like, all right, it's $50. Send me a picture. Like, they don't really, but they charge us some. So I think they're charging us for like the small component
Yeah, it'd be a-
replacement or something. You know what I mean?
Yeah,
and
you're
where
right, I
it's
have done
with
that in
the
other
system.
towns, and that has fallen under component inspection.
Right. I mean, most of the time, like you say,
Have it
it's
directly.
included because you're paying for it when you're doing the septic. But there are cases where you do come across it just on its own. So there should be a fee attached to it.
Yeah.
Especially if somebody's switching over to sewer or.
Yes.
And maybe it's
Yeah.
just as simple as writing something like that if it's individually done.
if they're switching over to sewer, that's the sewer department, that has to be pumped and decommissioned and.
No, it's still the
No,
Board of Health's
no.
job
Board of Health.
to inspect
Title
it.
gets involved in the.
Yeah, I mean, some towns
Decommissioning.
don't.
Sometimes
They
don't.
pass it on to there, but they're still turning a thing into the Board of Health. They're just taking liability for it. So like Westboro, all those towns come out themselves and look at it. Northborough takes responsibility, but they turn the slip in that we turn to the Board of Health when they're done with it. So they're still filing that they're just signing off on it.
So should we
Board
charge?
of Health is responsible for all aspects of septic systems.
Yeah.
So it looks like $75 is what Shrewsbury's charging for decommission.
I mean, we don't do that many.
We don't do that many, but
Not many, but
they don't do the paperwork if they don't have a fee associated with it.
Right.
Maybe we should charge $75 for it. Should we charge $75 for it?
True too.
What do you have for a small component? You just
We
charge?
do require a licensed installer if either one of them.
Yes.
So, I mean, we just want them to send the sands, the slips and pictures
Pictures.
usually.
I think 50 would be more adequate than 75, because they have to pump that and everything, so.
Maybe just reword it as done as a single component or or when done as an individual job, instead of, that way you're not, people
not
aren't
part of
adding
a
into,
system
the
repair.
system repair.
Yeah, if it's not part of a system repair when they're replacing the septic system.
So
Right,
so
some sort of-
Do you
decommissioning,
think-
septic system abandonment, individual event, or something like that.
Do you just think
Or something, I don't know how you wanna call it, but,
Yeah,
that a professional,
yeah,
a
individual
homeowner
event
would
or
know what
a,
that would mean? If you had kept it simple?
No, but even just in the office, so it doesn't automatically
Not
get
in
thrown
corporate.
in, so we're like, all
Right.
right, why aren't we in the admin, you know what I mean? Just, who knows if help changes or whatever, it doesn't get added to all the plans, you know what I mean? So I know Judy ain't gonna be here forever.
Yeah, she is. She said she was.
So we have a small component repair, or you just do the one repair, just the one construction? permit?
$175 per component.
For it doesn't, so for component or for a complete system?
No,
No, that's component.
a tank, a D-box.
D-box.
Any single component.
Single, all right, see, I see it, I see it.
It's 75. What was it?
175.
175.
75.
So get back to this decommissioned septic system. We wanna charge $75 for that? Is that the consensus?
Yeah,
Everybody good with that?
75?
75.
But do you
so
want to
as,
only,
as a single component, as a,
As a,
not when it's associated with a,
Septic.
with a,
with
with a,
Replace
full
it.
Repair.
repair.
so when,
Repair.
only when solely done as
Just a
its
complete
job itself,
abandonment.
yeah, as an abandonment.
I don't know how you Steve and I were just talking about that, how to word it.
How to word it,
Yeah. We have an application already, so.
Really used.
for a system abandonment, you have a form?
We have a form.
Not associated with other system.
No COC fee?
COC fee.
Lester's the only one that charges that, huh?
Well, the towns that we have here.
What's that?
The COC fee. So what do we have for fees for the pumpers? Just the license,
That's it.
a yearly license?
Are they still reporting where they're pumping it from?
I get pumping slips.
You do?
We get
I
pumping
do.
slips.
Okay.
You're welcome to come and
Supposed to,
review
it's the
all
law.
of them. They're 2 drawers full.
Yeah, I mean, it looks good to me.
Now, we have to approve, do we have to vote on these and ask for a public hearing, or do we get a public hearing and then vote on it?
Yeah, we have to vote on the
We
public
have to do
hearing.
a public hearing.
First, and then vote on it to approve them? That works.
But I would just recommend, because I'd like to also, if you're doing fees, do all the fees in the board.
Oh, yeah, everything needs to be wrapped up in this whole public, yeah, right, right. That's what we do, kind of, we're shooting for like maybe September or something this fall. You have all this time on your hands, yeah, probably.
You see how neat our office is.
It did look a little different, I was like.
Well, I
holy
think
shit, what happened?
originally we were trying to push this through to get, to pay for Steve, right?
Yeah,
Yeah.
rare. Well, we could do that and then just do yours.
But it's been put off so long now, I don't know, it doesn't matter to me, but.
Well, how, would you, is it feasible for, like, if we were gonna shoot for, I think we were shooting for a September public hearing, I think is what we,
That's what we mentioned
I think that
before.
was what we mentioned before. So, is it possible for, possible for like you or whoever to have the fees that you would like to change available at the next meeting, and then we can shoot still for the public hearing in September, does that, or is that just, cause I know you guys are swamped. I know you don't have any time on your
I'm
hands.
on a
but-
vacation. I haven't had a day off in a year and a half, so I'm looking for a day off one.
Okay, well, on your vacation, you can.
I think it's July 27th, I'm looking to take the day off. Oh, that's our next meeting day, I'm sorry.
No, anyway, whatever you,
Yeah, we'll try. We'll try very hard. It's just like more or less the food that we
Okay.
want to do. I want to do.
Well, we can put these in for September anyways, right?
then we have to have two
Yeah,
public
cause we
hearings.
revamped them not too long ago, most of those,
I think everything was done around the same time,
yeah.
so,
July 1st, 2015
yeah.
Long time ago.
is when we last did
Can we help with that?
Yeah. If you all want to just take copies of the, we'll give you copies of the fees. And if you want to go out and just do some work on your own, and maybe we can come back and, I don't know, have a workshop or something.
Or we could do it at the next meeting.
Do it at the next meeting, we can just all do it all together. Everybody can come with their figures, or what they
Okay.
want to do, and we can just work it out then.
I'm going to Disney Friday, so I can do it down there, because I ain't going on any of those rides. I'll do it while I'm in line.
Yeah, I think if you give us that, we can have it ready for the next meeting.
And Steve, the changes here are just what we talked about, right?
Yeah, when we sat down, Kenny, these are the ones we came up with.
The perk extension, which is always a little confusing, is that how the other towns do it too? Is it a 2-year perk extension?
Yes.
Yeah, okay.
the sections here, the plan requirements, you're just looking for more detail in topography, is that what is the current contour like different than 2 feet? Or something, or?
The standing under the, currently, is that, topography has to be at least 100 feet beyond all area of work. That's substantial.
Yeah, that's ridiculous.
It's ridiculous, okay,
yes.
all right,
And a
okay.
couple of engineers who are on around here have done that.
Okay,
And
Right,
it's
so
probably
we
taken
don't make
5
them do
times.
it.
Yeah.
right, okay. So this is, right now, you have the topography going out at least 100 feet beyond the work area, and the plan is to pull it into how far?
I just wanted to state within, proper engineering practices, let the engineer make a decision what's gonna encompass,
Alright, okay.
area suitable for them to
All right,
design.
okay, okay. All right, so the highlighted stuff is the change?
Yes.
Is that right? Okay, all right, very good, okay. All right, that makes sense. Okay, so you're just leaving it with the engineers to do what's industry standard. That makes
Yes.
sense.
What about grease traps? Is that incorporated somewhere in here? What's your involvement with that?
Grease traps fall under the plumbing code.
Yeah.
Yeah. I mean,
Yeah, but they also fall into Board of Health.
for the tanks, they're outside, I mean, that's part of the inspection. I mean, they have to design it, it's part of the design plan. They'll have to show it, and if they, install it outside
So it's a
tank.
plan review for that?
It's part of the plan review. If they do individual grease trap, outside grease trap, that'd be like a component inspection.
It's not, we don't have it spelled out, grease trap on there.
It doesn't state grease trap,
No.
no.
Don't we have one recently that you're doing?
Not that I'm aware of. Is there one coming my way?
I thought
Isn't there was?
Oh, we had one.
Did you do it already?
I don't believe so.
With the country club? No?
Well, you will be doing one.
It's outside, not an inside?
I think it's
I
outside.
thought it was an outside.
This multifamily systems thing,
Yes.
so you're saying that a new multifamily has to have separate septic systems?
Yes.
That's fine. And then, but if there's a duplex that shares a common system and they have to replace a D-box or something, they're gonna have to put that on.
I mean, if it's currently a existing duplex with a shared system, I mean, it's gonna stay that way.
Okay, that's the way I'm not
This is-
reading it, okay, I'm not reading this right.
For all new the new, second
All
word,
new.
new.
But it says in the
dwellings.
case of a repair, okay, well,
In the case
the
of
way I'm
repair,
reading this implies like obviously new it has a separate systems. In the case of a repair, obviously that's not new, right? If it's a
Right.
repair,
Yes.
then that leads me to believe that if it's any repair, it's going to be forced to put in two systems. That's the way I read that, but maybe I didn't read it right. If you can get two septic, if you have to, if there's a current duplex out there or something on one system and it needs a new D-box, the way I read that is, if there's a way to get two systems in, you have to put two
Well, a
systems in.
D-box, yeah, I mean, a repair, is the new system. A D-box is a component replacement.
Component replace, okay, all right.
If they just need to replace the tank or a D-box,
Okay.
usually it's a D-box. They would just pull it in a
Okay.
single component, replacement.
So we need to,
but-
in case of component, am I reading this wrong? Or is,
Title
I
V
understand
repair
there's a repair is different than a component
Yeah,
replacement.
repair and a Title V is pretty much a replacement of the leach system.
Of the leach system. In
Yeah.
that case, you want them to put into system, in the case if they gotta replace, I say the leach field fails.
They could, if they have, currently, if the system is, a single system for a duplex,
Right,
and the duplex is in single ownership
right, okay,
of a condo or whatever,
right,
then we can allow them to continue.
okay, all right,
that
okay,
way.
all right.
If it's in separate ownership, we want them at that point to separate it if they can.
If they can, okay.
If it's, I mean,
Okay,
if it's not
okay,
feasible on the property to be able
right.
to do that, then.
Right, they're not gonna be able to do it, okay. I'm just thinking how that's gonna impact, people that own income property. I mean, I'm not saying that we should or we shouldn't, I mean, it's obviously, I'm sure it's better from an environmental
But
standpoint.
if somebody owns income property, that's one owner.
okay, that's right, is one owner, okay, I'm thinking
Single
about,
ownership.
okay, it's ownership, not
Correct.
Yeah,
It's
it's when you
ownership.
actually
Ownership,
own it.
not tenants.
Ownership.
Okay.
Ownership.
right,
yes.
I'm wrong, yep, never mind, okay, yep,
Yes, correct.
okay, that makes sense, okay, that makes sense.
It's a nightmare just trying to deal with two different owners all the time. You get them to split the cost.
Right,
and
right.
I've run
also
into
the
twice.
agreement.
Right.
Where one of the,
That makes sense,
duplex,
yeah.
one of the owners did not,
You would
offer
not,
up.
really,
Somebody was selling and they had failed Title V.
and they,
Twice in Uxbridge this has occurred. I've been part of that, and
huge pain in the ass.
one occupant of one of the units had to pay for the entire system as they were selling.
That sucks.
So,
Right,
in one case, it was an elderly woman. The other half had a full family.
so they know they were beating the system up.
Oh yeah, and then some. And the other half wouldn't put in a dime.
That's just a shame, okay, so that's a way to
Try to get a-
separate these.
Yes.
That makes sense.
Whoever's responsible for their own.
Own system, yeah, that makes sense, yeah. That makes sense.
So,
Okay, so the fees, gonna adopt those, and then we'll adopt these for the septic stuff, right?
Yeah, we gotta do the public hearing.
Have that, here.
what about the wells?
Wells, yeah, Steve and I spoke, and I'll let him chime in mostly. Overall, he thought it was
For the most
suitable
part.
for the community, overall, our well inspection, there was a couple of things, let's see, was the cross-contamination.
Yes.
Which Steve will talk about. And the other thing was, we talked about this before, we have full gamut of testing for irrigation wells. Steve thought that maybe that was overkill, but we can talk about it.
Yeah, I don't think we need that.
Yeah,
For
and,
irrigation wells, we don't need to do a full gamut of testing.
and then I had a couple other questions too, but I'll just hand it over to you, Steve, so you're the expert, so.
The only thing that really came up with is when we were dealing with the car wash recently, the cross-contamination issue came up, and we didn't have anything in our regulations pertaining to that. I did find it in Northbridge, they have something, their regulations that's states a definition of cross connection, and then it says no person shall allow the connection of any building or any facility to the municipal water supply and to a private water supply concurrently. Such constitutes a cross connection and is prohibited. So having public water and a private well.
So we had that with Atlas Box, they had to keep it separate. I thought we had that in our regulations.
I didn't see it. If it did, I missed it.
I missed it
We
too.
get into that with Atlas Box.
We rented that down on the plaza, and a couple of the tenants down there.
I don't know if we ran into that with Atlas. I remember the Atlas box issue, but I can't,
Dialysis center.
Yeah,
oh, Dallas or something, okay. So I don't remember reading it either. I read through these. I don't remember seeing a cross-contamination, via having public water and private in the same dwelling either. I don't remember seeing that in our current regs. And Steve, I don't think
I
it's
didn't
there.
see it when I read through them.
No. But I know we've had discussion about it.
yeah,
We've discussed it,
With
yes.
issues. Yeah,
yeah.
I think we may have insisted on it as a supplemental thing, just because
Correct.
we did.
I think we
But now it's
did.
in the regs, so.
I think
that'd be
that's
a better
good.
thing, right?
Okay.
Yeah,
that's perfect,
Yeah.
yeah.
Okay,
yeah.
Because I have a feeling it's gonna come up again.
Yeah, I'm sure eventually it will. So I think that should be
Yeah.
added to our regulations. And then
Right.
the only other thing was the issue with the well, the testing.
Yeah, the well testing,
Permits for the
irrigation
testing.
well, which, we have the full gamut. So do you think any testing would be I mean, we talked about, it. What other?
For an irrigation well, if it's just strictly for irrigation, I don't.
Didn't we have an issue where somebody had an irrigation well and they turned it on and they switched it over to their portable drinking water?
Well,
I think we talked about that as a potential thing. I don't know that we ever had it. I don't remember that
I
ever.
think it did
Right, I
happen
mean, you
once a
can't,
while
I mean, you
ago.
can't,
if they would do that, they should, at that point, need to have the water tested.
What about
Well, we don't know that, though.
Kids
It's
drinking it from
automatically just
hose.
done.
I agree with that, but I don't know if we should penalize
Right, you can't fix stupid. I mean, it's, if somebody's gonna
We
do
can try.
something stupid.
I mean,
No, but really, I mean, anybody can do anything.
Yeah,
Yeah.
I mean,
They could run a water line down their septic tank and start drinking it. I mean, it's.
I mean, I,
Right.
um, so I mean, it's up to, obviously, I don't know, how does everybody else feel about just knocking off the irrigation well testing? I'm
Well, as
in
long as we
favor.
keep the system separate, yeah, I think we can.
Right,
You
maybe
can al- you
attach
know
something
what,
to a
you can
permit.
also bring it up on a case-by-case basis.
Right, and you could attach something to the permit saying this could never be tied in as drinking water.
Right.
You know, you have to set forth, you know, just put
Right.
some sort of notice on there that you're giving those people the heads up that you can't just tie this in and start
It's for
drinking.
irrigation
it.
purposes only.
Right.
Right. Exist, you know, additional testing and other
Be
permits
required.
to be required in order to
If you,
have it be drinkable.
potable use.
Right.
Well, we could think about it too, we can talk about it the next meeting, right? 'Cause we might be-
Mull it over.
Yeah.
Sounds good. Other business not anticipated.
Oh, I did have one other question for you, Steve. Sorry to interrupt you, Bill. The secondary standards are just totally optional, right? The secondary testing standards for the state and for us, there's no requirement to test for the secondary standards, and there's no requirement to do anything about it if they exceed the max contamination level. Is that the way?
The secondary.
For the secondary stuff, okay, all right, okay. And we're not forcing people to test, are we forcing people to test
No,
for those?
Thought we do.
I think we do,
Some
but
of
we
them.
we
They
don't.
test, but we
there's
don't have a
nothing
requirement to filter.
to
For
fix it.
filter, okay.
Right.
The other question that has come up, and I don't know if we ever got any resolution about it, is the whole calculating for the, the radioactive stuff. And I don't know what, you were always,
Yeah, they always ask her, right?
Yeah,
I do it.
yeah, she does, so I don't, and we always talked about that as a you shouldn't have to do it, number one, because you got all this other stuff to do, right? And two, it's a liability, for us, the board and the town, to have us doing all these calculations for, gross alpha and all this other stuff.
Yeah.
And we talked about this before and never really came up with a solution for it, and there may not be a good one. But
But what happens is, we're requiring these testing, okay? So then people say, okay, I sent you the results, what do I need to do?
right,
You're the one requiring it, we have to tell them what they need to do. So,
Are
the only
these
way to tell
state-
them what they need to do is to figure out what they need to do.
is this optional for us, or is this a state requirement, this stuff here?
I think that's from the state.
That's a state requirement.
That,
It's
So,
from the state, but
yeah, that's part of the state.
So
So I
can't we
Private well.
make it mandatory that whoever those labs testing it has a simple line on there that says these pass the state mandatory results? I mean, a lot of the labs do that already in other
they
testing.
highlight them, they make them darker if they're outside the limit,
The
but
limits.
they don't,
we've
lot
talked about this,
easier.
I don't know if there is a
Yeah.
solution,
If
but.
they did, it'd be a lot easier. You just
Well, because it puts it on
Pass it.
them, like it doesn't leave her, and it doesn't even figure out, she just looks up, pass.
No, but then
okay,
when they
but
pass
no.
them into the Board of Health, they'll say, oh, well, how come this is highlighted? What does that mean? And so that leaves it onto the,
They can't call the
Department.
lab, won't the lab tell them? The
no,
lab doesn't tell them?
no, the lab don't even give us the results.
They can't Google it?
I don't know.
It's
I don't know what.
beyond their pay
I mean,
grade.
It seems like an unnecessary burden for you to be doing, and it.
Well,
and
we can
seems
give it
like-
to, we can delegate it to Steve. Look at his, gonna smirk on his
So
face.
those lab, their lab,
I actually do delegate it to Steve, but I just do it for him.
so you're saying the lab, that's doing the
Right.
testing will not explain what the test results are?
I don't know, they do, when the
Like
results
just the
are
Title V
high,
testing and all that stuff, they explain whatever you want.
bold when
they
they're
put them in
above the limits.
bold, but
That's
it's
all they do.
not, no, it's not
They
clear
don't
to
explain
people.
why, how,
It's
what to
not
do to
clear to people.
remediate it, things like that.
People wanna know, so, okay, here's my results, it's, quite a few pages.
Yeah.
And they're like, I don't understand anything, what do I need, what's my next step?
And none of those labs have anyone that'll talk to the customers?
That tells them the next step?
No.
I don't
Oh,
know.
God,
They
no,
won't tell them
no.
the next step, they'll tell them, if you ask them, why is this high, they'll explain, why that's high, but they won't tell you what to
Right.
do.
I know
And
the
I
labs
notice
I
a
deal with
lot
on
of
the simple
people,
tests
too,
tell you whatever, I mean, they go into
don't-
great detail. Just on Title V testing, it's a lot easier. It's not that
Not
sophisticated.
on water.
Yeah, not
It's
on
usually the water, because we have an extensive water
No,
test.
water, well tests,
Oh,
Title V
okay.
well tests. Yeah.
But do they all have the same water testing that we have? Because we have
No.
pretty extensive.
No.
Well, for
It's
Title V,
not,
when
no,
it's
but I'm saying the
not-
lab themselves
Oh,
will go into detail and explain to the customers why we're looking for it, and you know what I mean. They've always been really good with it. And I don't understand how you can pay a lab to do something and not get an answer from them.
well, the results are right there. They speak for themselves.
Yeah, but they
Even though they
I've never
don't.
had a lab not explain what the result meant. I've never seen that. You
Well,
paid for them to do
The
it.
lab does give the
Parameters.
results for
Yeah.
these radioactive substances, right?
Right.
Yeah.
Right, stuff, but then there's a series of calculations that need to be done. If gross alpha exceeds a certain amount, then you do
Correct.
this, that, the other thing, right? And that's what Judy's having to do. I guess the labs are unwilling to do these calculations.
I don't
right?
know.
I think somebody actually tried to do that before and they
The lab said no.
didn't even know what to do.
Really?
Yeah, they just test it, they're not
Yeah.
gonna,
And
you
the
think you
state's
gotta go to
making
a-
us do
The
that?
state makes us do it, and then they don't give us
And they want us to figure it out?
so far Judy sits there.
Isn't there somebody at the state we can ask about that?
Such as, I'm trying to think who.
Well, it's-
Paula Karen?
It's our regulations that we've adopted, though, for these.
It's not a minimum state requirement, it's our add-on.
I think there's the
Well, the
state
state
now.
has, it's a recommendation from the state. These are our well regulations.
I talked to Paula Karen about
Yeah.
this once.
We did. Well, but because we had such a high level of arsenic and radon,
Right,
we started mandating, that used to be our requirement,
right.
and the state picked up on it, and now they have made it theirs. So what we had started, now a lot of it's become state required.
Yeah, I remember brings back shades of red of the same conversation. We never could come to a good resolution around these calculations.
Do you want to
which
give Paula
Judy
Karen
does.
a call?
I could give Paula Karen a call.
I mean,
Yeah, send me her now. I'll call her again and ask her. Maybe they have somebody could just maybe they have somebody over at the state just shoot the results too, and they do the calculations. Yeah, unlike.
Or you get more money for it, you get paid to do it. I mean,
a
I don't know.
stipend. I think Judy needs a stipend.
She does need a
Like
stipend.
grant. Yes.
How many wells do we drill in a year, for average, like in this town? Like that you got to do this for?
This year's
25.
booming, right?
Yeah,
25,
Oh, that many?
Oh,
30.
30?
I was gonna say at least 25.
I was gonna go up to 30, but I said I'll be a little conservative. Yeah.
And sometimes there's stagnant wells that we just require testing on
Yes.
occasional.
How often do you have to do these calculations? Because if it doesn't exceed gross alpha a certain amount, you just don't do any. You don't do any of these calculations, right? The way I read this.
Correct.
How often?
It's pretty frequent.
Pretty fair. So it's the
Yeah.
majority.
More often than not.
More often than
Yeah.
not. Okay.
Gee.
Yeah, I'll call.
I'm used to it now, I mean, but
Give her a stipend.
Okay.
We'll put her on the payroll. Give her a stipend.
I know. Yeah. All right.
That just stinks though, if you make a mistake and then someone
She
comes
doesn't make
back.
mistakes.
No, but you know what I'm saying? Like,
I know,
like
it's a
John's
big
saying,
responsibility.
It's a big
It's a big
responsibility.
responsibility. You know, you got some. This gets. You know, you make a simple math error, and now it should have been filtered, and it wasn't, and you got a family, kids there for. I mean, it's serious business, right? So, and not that I don't have total confidence in what you're doing, but it's just it takes on
Because
big
more often
liability
than
for
not,
us.
they have to be filtered, don't they? The ones that
I
you,
think we had this conversation before, I think, about this. Yeah, I'll call Paul Karen.
okay.
Other business? Next meeting, 7/27. Everybody make it?
I may be off that day.
Mhm.
it's on the fourth,
Be
fourth Tuesday.
the middle of July already.
I know.
The end of July, the middle of
This year's
summer.
gonna fly by. July
When you did these, pricing for proposed fees, do these fees incorporate your fee schedule and not reducing what the town already gets? Do you know?
This is strictly what the town is charging,
Yeah, so what,
town fees.
the town fees, does it
So that
cover
would be a conversation with you,
your
Kenny,
fee and what the town is currently getting? That, I guess,
Is what the town is charging, does that at least cover my fee? Is that what you're asking?
No, I'm asking if it's covering your fee and what the town has historically been getting for fees.
See, I don't know what the town has
You
been.
know what, Judy?
Okay,
I
that
think
piece.
Kenny can work with you on that, because he
Alright.
knows, yeah.
All right.
And then if there's any difference, maybe you can make the recommendation changes, and then we
Yeah,
can
I'll
send it
have
to the
to,
next
I
meeting.
have that, I just didn't know if you already had looked at
No.
both of those
No.
columns when you did this.
Yeah, we didn't look at those. no.
Okay.
Yeah, Bill did a lot of work with accumulating this information. These.
Make a motion.
Making a motion to adjourn?
I'll second it.
Done deal.
Good night.
I'll say, Chris? I'll say?
Yep.
Thank you.